us of what you're voting on, any bills or anything like that?
Right. Well, a lot of people ask me that same question around the district because they get a form letter that doesn't answer anything that they asked in their letter. And they're very frustrated by that. One of the things that I thought would be fairly effective was to use Facebook, really. That, it'd be in real time. The legislation that's facing us in Congress, we'd put right on Facebook. And then I would, ask the people in the district, how do you want to vote on this? I mean, what do you think? Give me some input. I would, put my thoughts down in there, and then there'd be a room to comment. I think that's worked for some people in the legislature already, and some people don't have internet access or not familiar with Facebook, but at least there would be, I would think, a representation of the district in real time, so you're not doing it after you voted, or you have actually time to talk to the constituents, and by email, of course, as well. But that's what I was thinking as a way to do it. If anybody got any other ideas, I'd be happy to hear them.
Dr. Dan, this might be something that's definitely near and dear to your heart, the medical side. I was diagnosed with Crohn's 37 years ago. All right, we're self-employed. Because I have to have health insurance because I don't know when the next time I might end up in the hospital.
Right.
It costs us $1,200 a month to have insurance for us as self-employed people.
Right.
Anything that's worthwhile that will cover me. I'm on, for the first time, there's a medication out there. I've been in remission for 4.5 years now. But the medication itself, without any kind of insurance, is $1,500 a month. I have to be on this for the rest of my life. It's the only thing that keeps me out of the hospital and Crohn's free. What do you want to do, or what are you going to be able to do for us? We all agree that there's something that has to be done with our medical situation out there, insurance. What are your plans for us?
Well, that's a good question. I believe really in the free market and in patient-centered reform. Number one, there needs to be competition in the health insurance business. All right, there's basically only one place you can buy insurance in the state of Michigan, and that's Blue Cross. Everything else is even more expensive than them. We need to open up health insurance across state lines, like car insurance. Basically, right now, if you want to buy your health insurance, you got to go to Blue Cross. But if there was Geico or Progressive, if there was like 30 different companies able to compete across state lines, then you'd be able to buy the coverage that you need, and it would be cheaper. Because if you buy a car, there's only one place to buy a car in the state. They tell you this is the price, take it or leave it. Whereas if there's 30 places to buy it, you're going to be able to pick the coverage that you need. You're going to need more coverage than someone who's 20 years old and healthy. And that's part of the problem with the health insurance business. The states mandate a certain amount of coverage that you have to carry, like maternity coverage when you had a hysterectomy already. And that's ridiculous to carry that kind of coverage, and that adds to your cost. The other thing we need, of course, is tax credits, so that you can buy your insurance yourself and not have to be tied to an employer. Right now, your employer buys your insurance. You're not paying any tax on that. Whereas if you had to take your salary and buy insurance, you have to pay your payroll taxes, your Social Security, your income tax, all that out first, and then pay for your insurance. So that makes it more expensive, and doesn't let you carry your insurance from company to company throughout your life. So you don't have to be tied to an employer, and then maybe change employers, and then have to get a new insurance policy. Then you worry if that insurance is going to cover you because of the fact that you have a chronic disease. So if you have personal ownership of your insurance, then you can carry it with you. The other thing is health savings accounts should be tax credited as well, so that you can use health savings accounts to be the initial portion of your payment. Tort reform, and then there has to be some sort of a baseline coverage for people who can't afford insurance and who have chronic diseases or are disabled. So there's got to be a bottom line support mechanism for those people, but it doesn't involve having the government take over the whole system, because the